Hi everyone, this is Garima. Hi Cha, thanks so much for the introduction. And hello everyone. Great to be presenting here on behalf of Labs. It's a pleasure to be talking about what at Labs we have been doing and especially how we have been partners in life, literally for all the health ministries and the ICT ministries in the countries that we operate in order to improve health outcomes within the health system by leveraging technology, especially focused on data-driven clinical and operational decision making beyond just the digitalization part of the health system. In terms of how the agenda will run, we'll just talk very quickly about what Medtronic Labs is all about and then dive into our open source platform demonstration, that's SPICE, which is a data-driven community-based healthcare delivery tool. So with that, maybe just explaining the source of Medtronic Labs. We are a nonprofit, US-based nonprofit organization with multiple entities established in all the operating countries where we are present. We are largely funded by the Medtronic Global Health Foundation, primarily to support all the R&D and the deployment and development work around the SPICE platform, given it's a global good, a registered global good now. Whereas we also then raise funds across the globe with global as well as regional funders to be able to run the pilots along with the country governments on ground. So in terms of the program execution cost that exists, that's what we cover through the external funding. So with that, I think in terms of what we do, we leverage technology, which we will get into, that SPICE, to drive data-driven, community-based, integrated primary healthcare model to deliver health outcomes. It is cutting across community, facility, as well as national level health system workflows. And we'll get into the details of how we drive that connection in a bit. In terms of how we approach the model, as you can see, we don't consider ourselves honestly to be IT vendors. I started by saying we are partners in life for the government, so which means we start by the digital technology deployment, that's SPICE, or whatever form of co-creation we have done with the government. But then we do a heavy load in terms of the health system strengthening by building the capacity of the health system stakeholders to become more data-driven and outcome-focused, leveraging the technology and the decision-making nudges that exist. And obviously, as we all know, all that cannot be done unless, as partners, we have strong relationships at all cadres of the health system, starting from the national to the district or the county, as far as Africa is concerned, as well as going all the way down to the facility management. And a combination or a recipe of all these three things helps form the Medtronic Labs approach towards health system strengthening, leveraging technology. So very quickly, talking about where we are and what our footprints are. As of now, as you can see, we are present in about 5 countries in Africa. We are also operating in Asia, specifically in Bangladesh and Bhutan, besides the initial collaboration pilot work that we did in Cambodia and Philippines. And we're also present in US to support the low-income communities in specific locations. Leveraging and working with the various country governments, as mentioned here, as well as working with the development and multilateral partners, the nonprofits ranging from GIZ, COICA, Global Fund, and likes of them. As of today, the governments have been able to leverage SPICE to screen about 650,000 patients across various disease areas, enroll about 240,000 patients on SPICE, who then can be actively managed for improved outcomes, and more importantly, leveraging the whole platform and the data-driven decision-making approach. We have been able to demonstrate improved clinical outcomes for about 122,000 patients. And obviously, this all has been done by training the health force of about 8,000 health workers of various cadres across all the countries that we are present in. Specifically around Asia, since I think that would be of interest to some of our audience, we are focused on strengthening health system through digitalization and outcome-focused patient management. On the left-hand side, you can see we have a visual around Bangladesh. In Bangladesh, we're working with the Ministry of Health, especially the NCD department, and BRAC, which is one of the largest nonprofits there in the country, to be able to deploy SPICE specifically around the NCD disease, as was the demand from the government and the need statement. We are currently present in 2 districts, in Narayanganj and Nilpharmari, and covering about 181 facilities in total, starting from district level to the community level facilities, which are called CCs in Bangladesh. Leveraging SPICE and leveraging the scope of our presence, as of today, the program has been able to screen about 66,000 patients, of which 26,000 have been referred in terms of being positive for NCD care. And of them, about 12,000 patients are currently actively enrolled in the platform to be taken care of in terms of their adherence. As far as Bhutan is concerned, on the right-hand side, we are again working with the Ministry of Health very closely there, and with a larger consortium to focus on deploying SPICE for ear care as a disease area, which was a problem statement for the country. And this program is pretty unique because it looks at universal coverage of the whole country to screen all the children in the country, which is about 200,000 plus, over a period of 3 years, and ensure that each and every child who has been referred with any ear disorder goes through the whole care continuum and gets treated. So the program is not just limited to SPICE, but the health system strengthening component over here is very, very strong. And again, as of date, we have covered the almost half of the country, as you can see on the eastern side, and we continue to expand the coverage in the west, with a screening of about 80,000 children, about 10,000 of them referred with some active ear care issue, and of them 4,000 registered who have agreed for treatment. And out of that, 86% of the children as of today have been provided with the treatment that they need. So as I said that in the beginning, our focus is on health outcomes and how do we leverage technology for health outcomes. And that's why you can see in our matrix along with the government, the end goal is always to measure what the treatment levels and the percentages have been. So with that narrative of where we, what Medtronic Labs is, and what is our footprint and what we have done up till now at a high level, before we dive into the SPICE platform, just wanted to touch base on what the partner governments have seen as systemic health challenges in their respective countries, and how they have been leveraging SPICE to solve some of those issues in order to improve the patient outcomes. So if we look at community, facility, and health management overall, at the community level, and I guess a lot of this is known to our audience, but just to encapsulate it in the context of SPICE as a platform, at the community level, there are issues of general screenings that happen versus targeted screenings, which obviously results in delayed detection of cases across any disease areas. Secondly, even when the screenings are being done by the community workers, there is usually no or has not been any tangible tool which helps them act on the screening and refer the patients in a manner who can then be tracked at the facility and then also be followed up, right? So that results in ineffective linkage to care, wherein the screenings have been done, but half of the time we don't know whether the patients who were referred have actually gone, not gone, or what has happened to them. And thirdly, there is low optimization of the CHWs, which is the community health workers and network in most of the countries that we operate, which results in ineffective follow-up mechanisms, which obviously means that then even when the patients have been given care for the first time, the tracking of the adherence to treatment and the tracking of the follow-ups is very weak. at the community level as well as the facility level, resulting in non-tracking of health outcomes or poor health outcomes for the patients. If we translate or shadow these problems at the facility, there is lack of visibility on the patient referrals who are being sent from the community because there is no tool that longitudinally captures this linkage. Secondly, there's obviously a lot of facilities which have manual data capturing, which has a whole host of issues in itself, as we all know. And that also results in insufficient patient level clinical data capture to improve the care. Thirdly, I would say, all in all, there is a lack of differentiated care based on risk management of the patient, which means that everybody who is being referred is being treated, yes, but then the care matrix is not focused on risk stratification, which obviously helps in focusing on patients which need higher care at some point in time versus the other patients who are still in control for that disease area. So risk stratification and clinical decision-making, operational decision-making using the risk stratification is a gap in the facilities. And if we again shadow that all the way up to the health management, there is lack of access to real-time data. There is issues constantly around inaccurate, incomplete, and delayed data submissions, which results in delayed national reporting because a lot of time either the data capture is manual or there is a lack of integration of what is being collected at the facility and what we are expecting at the national level through a DHIS2 reporting or any other reporting tool that exists. I would say lastly, in terms of the whole piece around treatment, inadequate medication and consumables because of poor forecasting, because there are no tools that can help automate the forecasting, also results in poor management of the patient in terms of treatment. So these are some of the very high-level systemic health challenges which we wanted to highlight, and how the governments are leveraging SPICE to be able to address some of them. If we go from left to right, first of all, SPICE is being leveraged to do community screening, so digitalizing the screening platform and approach across all various disease areas based on symptom-based algorithms. It's not just that, but once the screenings are done, there is also targeted referrals based on risk stratification as the second box over here, which means that there is for every patient that is screened and then eventually diagnosed at the facility level, there is a risk score that is identified by the platform, which is based on the WHO's approved clinical algorithms, which then helps in personalizing the care for that patient at the facility, and then also prioritizing the longitudinal care of that patient in the community by the CHWs. Going forward at the facility, when the patient has been referred, diagnosed, and enrolled, the clinicians can also use the customized care plan to be able to do customized care of the patient, as well as look at real-time data, longitudinal data for enhanced management. That is the value that the SPICE platform provides, that for each patient, there is visuals for clear longitudinal data points, which helps a clinician decide how to improve their care based on the risk stratification and the way the patient has been performing clinically over a certain period of time. Now, if we come to the follow-ups, once the patient has been diagnosed and the initial care has been given, obviously the patient goes back to their village or wherever they're staying in the community. And that's where SPICE platform helps the CHWs use the same platform to do follow-ups of these patients to ensure that for the disease areas which needs continuous adherence and touch points, the patients are going and getting their follow-up assessments done, or the CHWs do those follow-up assessments in the community itself, depending on whatever the policy and practice in that particular country is. But at least at the CHW level, they then have an automated way of having the full list of the patients to follow up, whether for screening referrals or whether it is for their medical review due dates, or whether it is for the regular monthly follow-ups that they have to do. And these follow-ups are also done through a risk-based approach, so that patient who needs the care immediately is followed up first versus the patients who are fine and need to be followed up as per the medical review. Besides this, I think in terms of the patient engagement, the platform also offers the government, depending on their choice, to leverage it for tailored telecounseling, SMS-based programming, and peer support groups. All of that tailored towards enhancing the follow-up mechanism for the patient to ensure that the patients are adhering and are sticking to the plan that has been given to them by the clinician, because that's where the whole piece around health outcome improvements happen. If we are not adhering to the treatment, we're not improving patient outcomes. So with that, I think this was a quick summary of how we have been able to position SPICE and the governments have been able to leverage it in action on the ground. I think with that, I will hand it over to my team member to dive into the SPICE platform and then also cover the key features and then the demonstration. Thank you, and over to you, Selva.
Thanks, Garima. Hi, everyone. My name is Selvaganesan, and I'm the product manager of the SPICE platform. So, yeah, I think we can quickly start with an introduction of SPICE platform. SPICE is an open source integrated primary healthcare platform that is designed to enhance community health delivery, and also it empowers the healthcare professional to deliver a proactive data-driven care. The other key component of SPICE is, like as Garima mentioned about, there is a lack of, at the facility level, like they don't know if people are referred or not, because it is not linked. Both community and at the facility level, there is no linkage. What SPICE does is, it bidirectionally links both all the health work that is happening at community level and also all the health work that is happening at the facility level. So, for example, in a case where if a CHW is referred for hypertension to a health facility, now through SPICE, like since the screening has happened in SPICE, when the patient goes to a health facility, the physician will know the reason for referral and all the patient details of the patient, right? Like the physician will have a clear context of why the patient has come and what is the clinical history of the patient. The whole longitudinal journey of the patient will be, shown in the SPICE platform. SPICE bridges the gap between like community health and like health facility related health activities that are happening. And also, SPICE leverages clinical algorithms to, screen, refer, and manage patients based on the clinical risk. And also in terms of the global standards, SPICE has got the SPICE has been recognized as a digital public good by the Digital Public Good Alliance, which is a multi-stakeholder United Nations endorsed initiative that helps like organizations and countries to help to achieve sustainable development goals. So we got it like last year around like mid last year, the digital public good status. And also I've attached the open source repository of SPICE. Here you can have a look into it. So, okay, I think we can move on to next slide. Okay, so here I just wanted to, before getting on to the capabilities of SPICE, I wanted to explain how SPICE is embedded into an health system, right? So we have the structured like primary healthcare setup here in the screen. It all starts with the community, right? Like at the community level, a community health worker is assigned to one village or a cluster of villages. And basically, community health worker is someone who manages the population health of that particular village, right? The primary responsibilities of a community health worker might be to like give connect to health services, right? Like the families that are there, community health worker can connect to health services whenever it is required. And also community health workers does like, general visits to the patients who are having like chronic conditions and patients who are pregnant. The community health worker does like an, general visit to monitor the patient's conditions on a timely basis, right? So here, like what will happen? Like I'll give like a scenario. So these are some of the registers and workflows that we have as part of SPICE, the ICCM integrated case management and RMNCH workflows. In case of a patient or if a family member is feeling sick, he might like reach out to the community health worker, mentioning that like I am not feeling well. Now the community health worker does an ICCM assessment, and based on that assessment, SPICE identifies the risk of the patient through the algorithms that we have, and notifies the user saying that the patient has been referred for further assessment. Right, those things are all like automated. It's not like manual. Everything that community health worker does is automated, and automatically the patient will be referred to an health facility here. And now, when the patient goes to the health facility, the physician at the health facility will know why the patient has come and what is the medical history of the patient. The same patient, if he had had any comorbidities a year back, that will also be reflected in SPICE, and it will show the longitudinal journey of the patient here. And it will be easy for the physician to like make decisions quickly and start medical review now. So the physician uses like any one of the workflows that is relevant, right? Like in above 5 general register, under 5, these are like different workflows that we have for the health facilities. Now the physician does the medical review of the patient and sets a follow-up frequency that you need to like come after a month after taking certain medication, right? So that is also being prescribed in SPICE itself. So now based on the follow-up date, in case of the patient misses the follow-up, now the community health worker will get to know that this patient has missed the follow-up, right? It will appear in the chase list of the community health workers follow-up feature, right? Which we will show it in some time now. So now community health worker is collaborating along with the health facility and the physicians to make sure that the patient comes for the follow-up. So community health worker calls the patient or goes to the household to remind about and follow up, and this creates a collaboration between both community health and what's happening at health facility level, right? SPICE bridges this gap between like both the levels of health work that is happening, and it also ensures that patient is getting like continuous care, right? It's not allowing the patient to drop out and go into some critical condition, but it allows the patient to get involved in and like continuous care. So yeah, this is about this like whole service delivery at primary care. And yeah, and these are some of the disease conditions that at primary care SPICE like solving for: diabetes, hypertension, mental health, HIV, TB, malaria, maternal health, and also like immunizations. We also have like child health workflows and some workflows that are in progress, which we will, as part of the roadmap, we will complete it. And then in terms of key roles, right? Like the people who are using SPICE at both community and health facility level. At community level, if you see like community health worker will use SPICE, and also peer supervisor, one who is managing the community health workers and also who act as community health workers sometimes also uses SPICE. And at the health facility level, there are like a lot of user roles within a health facility. There are medical officer, community health officers, like physicians, like nurse, and also like in case of a facility has an pharmacy and a lab setup, they will also be having like pharmacist and lab technicians roles as well. We also have that capability. So yeah, this is a quick context of the disease spectrum and the in health system how SPICE is getting embedded. Now we'll jump onto the capabilities of SPICE quickly. So yeah, so quickly to start with, this is like community health features that are there. Firstly, it is the offline capability. As you all might know, in low resource setting, it's difficult for community health workers to do screenings or assessment of the patient. The whole community health worker module itself is offline first capability. Here you can see here like the screening of NCD is happening in the screen, where here if you see based on the values that are provided, SPICE throws in like a risk kind of a thing saying the patient is referred for further assessment on top of the screen. And also this risk, right, which is calculated is based on WHO's PEN protocol. So all the clinical algorithm that is used in SPICE is being backed by WHO's clinical guidance. And also we use like CVD risk levels also. And you can see here the message is shown as like referred for further assessment. Now the patient is being referred for further assessment to an nearby facility. The next capability is about like multilingual capability. You all might know it's very difficult in health. I especially at a community level to for people to use in like an English version of the app. They might prefer like a local language version of the app. This is a sample version that we have built in Bangladesh, where they'll be able to switch between two different languages, English and Bangla, based on their preference. And with the app completely changes into like Bangla version. So that capability is also like built in Spice. And the next is QR code for patient identification here. There is like a lot of challenges around patient identification in field, right? So here, like based on that, like for example, if a patient is coming to an health facility and a nurse has to enter like 13, 14 digits of the patient, the search for the patient itself is not a great user experience. So we have introduced this feature called like QR code identification, where every patient is given a QR code. Here you can see based on the scanning that happened of the QR code, the nurse will be easily able to identify the patient here. Like nurse don't have to like type all those digits to search for the patient. And this also solves for the duplicate patient records and all. And the last one is the targeted patient follow-up feature that is there. So in case if someone misses a follow-up, a community health worker will be notified that this patient has missed a follow-up here. You can see in the screen that patients who are missing follow-up will be like shown in this format. Now, a community health worker can directly call from the mobile phone itself to the patient and tell him to request him to go to the facility for assessment or medical review. And also, respectively, he can update the status of the call as well if it's successful or not. These are some of the community health specific features that we have in Spice. Moving on to the health facility setup, right? Like we have this risk stratification again, like based on the disease specific risk. We'll show like respective messages to the users that this patient is having like this risk. So based on that, it helps the physician to take decisions. And also the next one is interactive patient journeys. As like Garima also highlighted, we show the entire longitudinal journey of the patient, right? The screen that here like shows the BPBG assessments that is being done over time for a patient and how the patient is progressing over time. This gives a clear view of how the patient is progressing. And also we also show like almost like all the medical review history and prescription or investigations if there are any. And the next capability is in case if physician wants to prescribe medication or upload an investigation, then that capability is also inbuilt. A physician will be able to request for investigation, which is like a lab test, right? In this case, we are requesting for a lipid profile test here. And also the prescriptions are also like inbuilt, like they can prescribe medicines in Spice platform, right? And in case if the facility has a pharmacy setup, a pharmacist can dispense the medication through his view of the app. And then the next one is like, risk-based treatment plan, right? Based on the risk itself, Spice generates an automated treatment plan, but physician has the ability to edit the treatment plan based on the current condition of the patient. Now this treatment plan is, updated for that patient. I just wanted to, update one like critical feature that we developed recently and we are experimenting with it is in case if the patient's progress is not improving, right? In case of hypertension, if there is no progress in terms of hypertension disease condition, the values are getting higher and higher. And if the treatment is also the same treatment is provided for a long time, Spice generates a nudge and shows to the physician saying that the values are not like, improving, the patient is not progressing. Would you like to intensify the treatment? In case if the same treatment is provided for some time, it shows a nudge saying like, would you like to intensify the treatment? So that is some new feature that we developed and launched recently, and it's going like really well with the physicians. And yeah, moving on to next one, I think this is another critical feature that Spice adds value to the health system is the most adopted feature is the insights feature of Spice. We have developed this data analytics capability in Spice where, we deliver like right data to the right stakeholders at the right time. where all the operational and clinical KPIs. In case of operational KPIs, how every health facility is performing, how users in the facilities are performing, like physicians, nurses, how everyone is performing, right? And this helps in like a lot of decision making, especially at a government level. All the governments, most of the government stakeholders in like Ministry of Health and the district departments who are like managing like the community clinics and all, has access to this feature where they see how every community clinic are performing, and in case of any intervention, they'll be immediately able to act seeing this data, right? See, this captures all the spice data that's captured at field and at the health facility, and it tells the story of all the interventions that are happening. And also other important point to highlight, it's not only operational KPIs, but also the clinical outcomes, right? How patients are improving over time. If there is no improvement or less improvement, you can actually drill down deeper to understand why there is no improvement in terms of interventions that are happening. And also we have like you can set your like own KPIs, like lives improved, right? Like for every disease conditions, we have our own KPIs, um, and we have our like own KPIs that are tracked for like disease conditions, right? At the end of the day, like this is something that tells the story of the work that we are doing in terms of patient outcomes and operational efficiency. And one small like a module that is inbuilt within this feature is the reporting module. Like every health facility has their own registers, and Ministry of Health has their own registers that they want the facility to fill in every day. For example, the daily register that they enter manually every day in an health facility. So those things are digitalized fully. Those things they can automatically take it from Spice. They don't have to do any manual work in their registers that they have to write about the patient who was inpatient and outpatient records, and also those things are automated. And also in one click, we have also built a capability to send the data to the ministries portal, like DHIS2 system, right? So that kind of feature also we have developed as part of the reporting module. And the next one is we give access to this particular feature at every level, health facility, county, head, every level at the government, we give access to and monitor the adoption of the this feature usage, right? So everybody like takes decision based on this feature, like insights feature of Spice. Yeah, come like I think yeah, the next one is about the interoperability part. I just wanted to highlight, as you all might know, like how like the fire conversation is happening right throughout like the AeHIN community also. So Spice data is in like fire format, right? Like all the data we are converting it into fire format and storing it into our database. So in case of any interoperability request that comes in, which requires to be a fire format, we can seamlessly do that like integration with an external system. Yes, Spice is like fire compliant. And also we have like terminology registries like ICD-10, ICD-11, SNOMED, Law Inc., and also NHDD with respect to Kenya work that we are doing. And it is interoperable with like different system like DHIS2 system, OpenMRS, and other EMR systems that are there, and Kenya Health Information System. Also, like anything which is fire or non-fire, Spice has the capability to integrate that with that system. But if it is fire, then it is very seamless, right? Because we know the data format and everything is structured. You just have to plug into an external platform and start sharing your data and receiving updated data from those platforms as well. And also in terms of experience for us in doing these integrations, we have done like integrations with Kenya Health Information System and Kenya Client Registry System, and we have like started the Bangladesh DHIS2 system also, which is going like really well. So it is all in like fire format only, and then the data exchange is very seamless with like fire, right? Because Spice is like fire compliant platform, and all the data that's there is in fire format. Now we'll see a quick demo of the workflow, how it works actually in Spice. I'll hand it over to Vinay. Thank you.
Thanks, Selva. So in continuation to what Selva and Garima were just sharing, we'll like especially at the primary care level, when we are looking at a community health worker's scope of work, which comprises of like household management, and then like either starting the treatment on their own at the community level, or like referring the patients to the nearest primary health units. So maybe a couple of scenarios that we could go through. For example, in a community health workers app, once they log in, they see all the households that are kind of registered in their currently registered in from their catchment, their assigned catchment communities or villages. And then there is also an ability to filter according to the catchment communities, and also the ability to add a new household wherein once they start that in the household registration form, they will capture the details like the name of the household, landmarks, the mobile number details, and the wash criteria, just so that every household is kind of registered. That followed by a member registration, where again we capture their name, relationship to the household head, their contact details, their age, their gender, and then also their national ID. And then this is how like there's like all the members of the household would be registered. And then for every registered member, there is a possibility to either start a general screener at the time of the registration, where according to the age and the gender of the household member, Spice will come up with a recommended screener. Like for example, a 40-plus-year-old male should be screened for hypertension, diabetes, and tuberculosis. And similarly, the other age and genders would kind of be referred for another combination of screenings. Apart from that, we also have the standard the tools which are used by a community health worker. For example, if we look at, let's say, a case of a malaria patient in a household, if we look at a scenario where a community health worker goes to a household, and then they search for that respective household where they have either gotten a call or they are doing a regular visit. They select that particular member who's experiencing the symptom. They select the respective tool, and then they will ask for like whatever signs and symptoms the patient is experiencing or the household member is experiencing. Let's say in the case of fever, like they will ask, like they will check the temperature, they will capture how many number of days the person has had fever, and then the community health worker can themselves conduct a rapid diagnostic test for identifying if the patient has malaria or not. And then if the rapid diagnostic test has found out to be positive, then the community health worker can either go ahead and dispense the malaria drugs if they are available with them. And if it is not available, in this case, let's say we are demonstrating a scenario where a community health worker doesn't have enough malaria drugs available with them, so they will just check like not available. And then the moment they submit this particular form, Spice will automatically trigger a referral to the nearest primary health unit for the further assessment with the then once this has happened, the community health worker will explain the household member that which particular nearest primary health center that they are supposed to go to. In some cases, the community health worker would also accompany them to that nearest facility. But in either cases, when the patient shows up, the same malaria patient shows up at the facility, like the same George Kamara, 41-year-old male who was identified with malaria after the diagnostic test conducted by a community health worker, when they show up at the nearest primary health center, then the clinician or whoever the community health officer is attending to them will see the referral reason why they are here for, where they are coming from, and what was the date of onset, so that they can start the treatment accordingly and then go ahead with the appropriate workflow. Let's say, and this is the choice of all the workflows that they can go for, which I think Selva was highlighting earlier as well. And these are all kind of integrated in Spice. Like in this case, it will be like an above 5 general register, which will cover the capability of a malaria treatment cycle. And then once the medical review starts, the clinician or the community health officer can capture the presenting complaints experienced by the patient. They can capture their clinical notes. They can conduct a systemic examination from head to toe. And then they can also conduct an investigation where like just to cross check, let's say once they search that if this person is referred for malaria, automatically the lab investigation recommended would be a rapid diagnostic test for malaria or a microscopy. And the clinical decision support that Selva was just talking about is the moment we see that a positive lab test result is uploaded and it's submitted, immediately the Spice will throw a clinical nudge saying that would you like to confirm the malaria diagnosis based on the lab results. When the moment the community health officer clicks a yes to it, they are redirected to a diagnosis confirmation page where they can confirm the diagnosis of the patient. And then immediately after that, they can continue the rest of the medical review where they can go ahead and prescribe the appropriate malaria-specific drugs. Here as well, the moment they go to the prescription tab and they click on the search tab, the app will throw only the malaria-specific drug recommendations, which will kind of again save some time for the clinician so that like they can continue their treatment and move on to the other patients. Once all of this is done, the clinician can look at like a summary of the entire medical review, and according to the specified frequency of the next like for example, the prescription was written for 3 days. Automatically, the next visit date will be generated after 3 days, and a community health worker will get a notification that they are supposed to follow up with this particular patient so that they come back to the primary healthcare unit for their further treatment. So this is how like an end-to-end workflow for a patient, like a malaria patient would look like in SPICE. And similarly, we have incorporated the other workflows as well for the other disease conditions. So with that, I think we are kind of pretty much done with the demonstration of the platform. And I'll now hand over to Jai Ganesh to kind of take it forward from here. If like we want to like kind of have some questions, maybe have some interactions.
Thanks, Vinay, Garima, and Selva. I think it's very comprehensive presentation. I think a lot of questions have been already asked in the chat and have been answered also. Maybe but I will ask probably one. What's the pathway for engagement with countries and partners? Because I think that is something that many of our members here, especially like you have been implementing in a couple of countries in our region, but then there are members from other countries. They may be interested to know how do you engage with the countries, especially and the other partners. And then probably another question is like, I know Spice was initially a predominantly NCD-based platform, but then from that you seem to have moved towards the primary care model. Like, what was behind that? Like, what was the motivation behind that? Maybe I will ask those two, but there are some questions related to standards, but I'll come to that later. Thank you.
So Jay, to your point, I think yes. So when we started initially, we were focusing on the NCD in specific, and within NCD also hypertension and type 2 diabetes in specific, because when we were working with different health systems, when we were approaching and we were doing our research, we realized there was a lot of gap, especially like between the linkage between the community and the facility, which we kept highlighting throughout our presentation as well. And because these are the chronic conditions and lifestyle-based conditions, like adherence to the treatment was one of the key factors which would have led to improved outcomes. But because there was like missing linkage between the community and the facility, we saw there was like a lot of other factors as well, where because of which a lot of patients, even they were linked to care, but they were not able to continue in with the treatment, or they were not able to stay in the treatment for the according to the required protocols or the required frequency of the treatment. And that is where we thought it will be good to first try and work with the health system, co-create solutions with the health systems. And that is where we started with that. And the SPICE 1.0 version, which was focused on the hypertension and type 2 diabetes. We started with that. And then once we started working closely at the community health level, we realized that the entire scope of primary care itself is where all the features that SPICE was offering that could be leveraged for the entire scope of primary care. And then we realized a lot of other disease conditions are also linked to these conditions, and that's when we thought that why not transition to the integrated primary care as the scope of SPICE, and that then hence the transition. And then now currently we are working with some of the governments on the implementation of the integrated primary care. And also in kind of talks with some other countries in terms of how we can kind of expand to those countries as well. Hope that addresses, Jay, what you were referring to.
Yeah, maybe I'll just build on that, Jay. Sorry for the background. So in terms of the approach for engagement and partnership, what we usually do, since it's not that we have a given area to operate in, since our whole objective is to work with the governments and help them strengthen the health system. We usually participate in conferences, webinars like we're doing right now, and spread the word what we have been doing with the other countries, which are about 10 countries now. And based on the interest that is raised, usually we have follow-up conversations, understand the current health system of that country, understand where the need or the gap is, and then get to a collaborative decision on where and how the partnership should happen. So that it's a pretty, I would say, organic way of doing partnerships and engagements, which at least have worked for us, because then it is very focused on where the actual gap lies versus we wanting to push a product in a country, which is not really the objective. The objective is to not have parallel health system built in, but to ensure that we are supplementing what already exists and strengthening it. Hope that helps, Jay.
Yeah, thanks, Garima. Maybe one last question. I think we just have about 5 minutes, and then I see many questions also coming in. What's your strategy towards interoperability? I think this is a very comprehensive platform, very interesting. But then, like, there is always a need for being this platform being interoperable with the existing ones, and then the ones to come. Like, is there a particular approach towards ensuring interoperability? I think that experience, especially for AeHIN, will be very valuable to know. And then if you have any examples, maybe because you have been mentioning many countries that you work with, so maybe if there is possibility that you could mention at least one example, if there is time. Thank you.
Sure. Thanks, Jay. I think I can answer this question. So to start with, like, in terms of interoperability, we started, like, thinking about adopting to FHIR standards some time back. The decision to adopt FHIR standards, that itself indicates the commitment towards interoperability within healthcare ecosystem. So when we started, like how we started was we tried to build a FHIR adapter where our application lies separately. But if you want to convert the data into FHIR, we push the data through the FHIR adapter to convert the data into FHIR, and then from that it pushes the data from the FHIR server to an external system that is there. For example, DHIS2 system, the systems that are there, and like OpenMRS and Epic, for example, they also have like FHIR format. So this is how the initial capability that we built as part of the Spice platform. We did not have a FHIR native or a FHIR hybrid platform. We had a FHIR adapter, which was an separate isolated like system where whenever we want to convert the data into FHIR format, we use the FHIR adapter to convert the data and push it to an external system. But like later on, we had like different use cases where we have to update do real-time updates between two different systems, right? For example, when Spice is at community and if we want to integrate with a system that is used at a health facility, the update should be real time, right? Like that use case became very difficult when we try to do it through a FHIR adapter, right? Because it is not a very much of a real time update, but it takes some like time to update. And there were a few other use cases to leverage smart guidelines in future, right? Like in 1 or 2 years, like as part of the roadmap. So and then we decided that for long term we had to do an architecture update. We are working on like a new version of the app. So, and we decided we'll try to do, and FHIR hybrid version, which is a bit, new. Either there is FHIR native where you can use Android SDK and develop a FHIR native application, right? But we thought it will be good to start with an FHIR hybrid application where we have the primary database itself as a FHIR database, like stored in like a FHIR server. So all the data that's, coming into Spice will be in FHIR format just to meet the global standards, global interoperability standard. That is a huge step for Spice that we have taken recently. And also we are working with a lot of FHIR experts to do the mappings of the entire like platform into FHIR. And also this gives us an like a long-term advantage in terms of interoperability. Any external system with FHIR, the integration becomes very seamless, right? Very seamless and real time, and also an effort to build any wrapper or our own with respect to fire is not needed. It's just like direct integration with an external system. So with respect to spice, it started with an fire adapter concept, and then now we have moved into like a fully fire application. Jay, that is like an evolution that happened very recently, and that's a big decision for spice that we recently made.
Thank you, Silva. I'd like to thank the team, Garima, Vinay, and Silva, for an excellent presentation as well as a very quick demo about Spice. I think we got a good idea about what Spice is now. And then I'm sure that there have been a lot of interactions here, but then I think there will be much more to follow. So please, if you have any questions, more questions, and then any clarifications, please do reach out to the Spice team. And then maybe we will have probably another session sometime later in the year where we will have the implementation sites actually sharing their experience and then having that kind of a feedback from them. Thank you very much. Thanks for joining us.